In the bustling streets of India's vibrant cities and the serene corners of its rural landscapes, there's a silent epidemic gripping the nation's youth, one that often goes unnoticed but leaves deep scars: the state of teen mental health. As the world progresses, so do the challenges faced by adolescents. And in India, this struggle is reaching critical levels. Despite strides in acknowledging mental health, India still grapples with pervasive stigma surrounding it. Teens, already navigating the complexities of adolescence, often find themselves silenced by societal expectations, familial pressures, and cultural norms that prioritize academic success over emotional well-being. The fear of being labeled as weak or troubled prevents many from seeking the help they desperately need. I felt like I couldn't talk to anyone about what I was going through. It's like there's this unwritten rule that we're not supposed to talk about mental health issues. In a nation where academic excellence is often equated with personal worth, teens face relentless pressure to excel in exams and secure a prosperous future. The burden of expectations weighs heavily on their shoulders, leading to anxiety, depression, and even suicidal thoughts. The pressure to perform well in exams is immense. It feels like our entire worth is judged based on our grades. The rise of social media and digital technology has connected us like never before, but it has also created a digital dystopia where teens are constantly comparing themselves to idealized images and lifestyles. The incessant need for validation and the fear of missing out exacerbate feelings of inadequacy and isolation. Social media can be really toxic. It's like everyone's life is perfect except mine, and it makes me feel inadequate. Despite growing awareness, access to mental health resources remains a privilege rather than a right for many in India. Limited availability of trained professionals, especially in rural areas, coupled with the high cost of therapy and medication, creates barriers to care for those who need it most. There are no therapists or counselors nearby, and even if there were, my family couldn't afford it. The consequences of neglecting teen mental health are dire. India has witnessed a concerning rise in teen suicides, substance abuse, and self-harm cases. Each statistic represents a life lost or a soul silently suffering, unable to bear the weight of their pain any longer. It's time for India to confront its mental health crisis head-on. This requires a multifaceted approach encompassing education, destigmatization, increased access to affordable and quality mental health services, and the creation of safe spaces where teens feel empowered to seek help without fear of judgment. It's time we break the silence and start talking about mental health openly. We need more affordable and accessible resources for teens. Teen mental health in India is not just a personal issue, it's a societal responsibility. We must prioritize the emotional well-being of our youth, for they are the future of our nation. Let us break the silence, extend a helping hand, and together create a healthier, more compassionate society where every teen feels valued, supported, and heard. Consult with docindia.org for mental health, and together, let improve the health of our teens.